Hi, welcome back. So the other day, one of my colleagues, one of my registrars, sent me a message to say that her 6-year-old and all the other 6-year-olds she knows are becoming quite moody and emotional. And do they undergo some kind of hormonal change? And she thought I'd know the answer. So I did know the answer, and I said that she was probably undergoing adrenarche. So I thought I'd make a video about it because it's quite common. So adrenarche means awakening of the adrenal glands. And the adrenal glands are two small glands that sit on top of the kidneys on either side. And they produce various hormones, but some of the hormones they produce are male hormones. In particular, the hormones DHEA and DHEAS. So these are male hormones, essentially, but of course, all females produce a certain amount of male hormone. So it is usual for these adrenal glands to awaken and start producing these hormones at about the ages of 5 to 6 in girls and boys. But we don't expect to see the signs of these hormones until about age 8 or 9. The effects of the hormones are things that are mediated by male type hormones, such as the growth of pubic hair, hair under the arms, oily skin, body odor. Also, there may be a bit of a growth spurt as well, and also mood changes and sometimes behavior changes. So adrenarche is when the hormones are starting to be produced, and this is normal. But as I mentioned, they're produced in small amounts and then they gradually increase in amount until you start to see the effects. Now, this is different from actual puberty, which in girls means the awakening of the ovaries to produce hormones such as estrogen, the female hormone estrogen. And I've discussed all about periods and hormones in a previous podcast. So many times I will be referred girls who start having visible symptoms of adrenarche before the age of 8. And if that happens, for example, most usually pubic hair, if that happens before the age of 8 in a girl, due to this rise in male hormone from the adrenal glands, it's called premature adrenarche. Now, usually it is a condition that doesn't have any particular consequences, and usually it's something that's just monitored. But what are the investigations we do? So, if your daughter has growth of hair under the arms or pubic hair or any of these symptoms before the age of 8, it's probably sensible that you take her along to see her doctor or her general practitioner, and they will examine her and refer on, if needed, to either a pediatric gynecologist like myself or a pediatric endocrinologist. When they're seen, she will be examined to look for other signs of puberty, because as I mentioned, premature adrenarche is not the same thing as the puberty we recognize, so we'd expect that these changes are isolated and they're not associated with, for example, breast development or periods coming on early. If that was the case, then she would be investigated in a different manner. She would be examined to look for breast development, to look for underarm hair and pubic hair, and then a decision will be taken after discussion with you as to investigations. The most likely investigation would be some blood tests to measure the male hormones. And why do we do that? Well, we do that because these symptoms rarely can be associated with more serious conditions, such as a tumor of the adrenal gland or another hormone condition called congenital adrenal hyperplasia, in which excessive amount of male hormones or androgens are produced. Or there's another condition called Cushing syndrome that we try to rule out. We'd look for other symptoms or signs, for example, With premature adrenarche, we expect the hair growth to be a bit earlier than expected, but not more excessive. So tracking along the time frame for development of pubic hair normally, but just a little earlier. So it just means that the girl is developing at her own pace a little bit earlier than her peers would be, for example. We'd also look for other signs such as clitoromegaly, which means the clitoris getting bigger, which may be a sign of pretty high amounts of male hormonal androgens that would prompt further investigation such as imaging of the adrenal glands. Other hormones may be looked for just depending on the clinical scenario, but again, as I say, it is most likely something that can be monitored and is not usually a worry. Other things that can influence the development of premature adrenarche are things like if the child was a small baby at birth. Ethnicity can affect it. For example, Afro-Caribbean children are more likely. And body size, so overweight children are more likely to have premature adrenarche. Having said that, again, it's usually benign, and usually all that's required is monitoring and support as necessary for the child. And of course, being understanding as a parent about the mood changes, etc., that she may be going through. And I think it helps that it helps that parents understand that she's not just being naughty. There is something going on behind this. And of course, as time passes and she develops, she gets a bit older, it will become more steady. In terms of long-term prospects, we do know that children who have premature adrenarche are more likely to have polycystic ovary syndrome when they get a bit older, and I will do a video about polycystic ovary syndrome in adolescence, so keep an eye out for that. So in summary, if your child's moody when she's 6 or 7, it's probably not just her. There's a lot going on, and they're quite likely, possibly maybe a hormonal basis to it. So don't worry about it and support her. But however, if there are things like significant development of pubic hair or hair under the arms, etc., then do take her along to be checked. Thanks for listening. Don't forget, please like this video, subscribe to my channel, and join us on my Facebook group, Gynecology Girl Talk, where we talk about all things child, adolescence, in terms of gynecology in a secure, supportive and friendly environment. See you soon. Thanks for watching.